You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Welcome to another episode of Pharmacy, IT, and Me. As with every episode, we start off this one stating that the intended audience for this episode is everybody. So for today's episode, we're going to try something new. We're going to go over some of the headlines related to healthcare IT in the past week, just to keep everyone a little updated on what's going on in the healthcare IT space. So what I'll be doing is I'll be pulling some news headlines that relate to healthcare IT that's occurred in the past week that I think people should be aware of. So for the first headline, Meditech is integrating an opioid stewardship toolkit in their EHR. So the opioid crisis is a real thing, and it's a major challenge in the healthcare space right now. It's actually really great to see that a large EHR vendor like Meditech implement a toolkit that will help providers with finding high-risk patients and assist with prescribing opioids that result in a reduction of harm. The company did state that this toolkit will be aligned with the 12 chronic pain management recommendations from the CDC, and it will include access to prescription drug monitoring programs within the provider's actual workflow, so they don't have to get out of their workflow to use something else to get to the prescription drug monitoring program. And in addition, electronic prescribing for controlled substances will also be included. So the next headline is Providence St. Joseph. They will be entering into the population health space. So Providence announced that they are launching a new health company called AYN Health Solutions. Our healthcare system is in a continued movement towards a value-based care model, so it makes sense that Providence would have a separate focus on population health. AYN Health Systems or AYN Health Solutions will be providing pharmacy benefits management, risk evaluations, comprehensive reporting, and employee health benefits services. So the next headline is the Department of Justice fines Greenway with a $57 million false claims fine. So for those of you who don't know, Greenway is a company that makes EHRs. And in 2014, Greenway had a product named Prime Suite that was available for many users to implement. In order for these EHRs to be preferred in the market, they would attempt to be certified so that they would be more attractive to the clients. Unfortunately, it was ruled that Greenway falsified their EHR certification in 2014, and they're currently in penalty of $57.5 million. The Greenway product did not meet standards for certification, including not incorporating standardized medical terminology for electronic prescriptions, and they also violated the anti-kickback statute by actually paying money to client providers to recommend Prime Suite to their new customers. So the next headline is Epic is focusing on data exchange for value. So Epic is a major EHR vendor, and they will be focusing on how they can provide related healthcare data that will establish the company's footing in the new world of value-based care at the upcoming HIMSS 2019 conference in Orlando. In essence, their One Virtual System Worldwide initiative will be connecting all Epic systems around the world so that the data exchange can be leveraged for population health purposes. In addition, Epic will also be focusing on cost awareness and patient-centered care with their continued efforts to improve healthcare in general. And the last headline that I have is a new Commonwealth Connector program for interoperability. So if you don't know, the Commonwealth Health Alliance, it's a non-profit trade association that envisions data should be available to individuals and caregivers regardless of where care occurs. So their stance is that access to this data must be built into the health IT at a reasonable cost by a broad range of healthcare providers and the people that they serve. They actually have many alliance members, including eClinicalWorks, Cerner, CareCloud, Cario, Meditech, and actually a lot more. This past week, Commonwealth announced that they have a new connector program, and this offers access to the health information exchange network that they have for care providers who may not even necessarily be Commonwealth members. This is actually a big deal because this is a step in the right direction to the eventual dream goal of having all healthcare data accessible by providers and patients anywhere in the nation. With such a vast health information exchange network, this will greatly improve the quality of care that healthcare teams can provide to their patients. Alright, so that was all the news articles I had for this week. If you'd like to get more news, take a look at healthcareitnews.com. They have really great curated content on the healthcare IT space. Let me know if you like this episode format or not, and I may continue it in the future based on the feedback that I get. Alright, if you like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or or any of your other favorite podcasting services. You can also follow us on social media on Twitter, Facebook at PharmacyITme, or our Instagram at PharmacyInformatics, or you can also email us at pharmacyitme@gmail.com. You can also follow me on my personal Twitter account at TonyDaoPharmD, and our website is pharmacyitme.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.